Good morning. Greetings of peace to everybody. Hope you're enjoying your summer. Um, Today is, I think, August 10th and Tuesday, August 10th, 2021. Hope you're all doing well and that you've hopefully enjoyed your summer and have taken a break and out of the monotony of life and set some time for yourselves for rest and relaxation. Today, we're discussing the imminent back to school. A lot of children have gone back to school now, and schools have slowly started to open back up. And we have a lot of people that have a lot of concerns. We've gotten contacted and questioned a lot about what's going on and how to navigate going back to school in an epidemic or in a pandemic. As you all know, COVID is here still, unfortunately, and we do have the Delta variant, which has taken shape here in the U.S., and the numbers have increased. Fortunately or unfortunately, we can say that it's become the pandemic of the unvaccinated. Fortunately, we do have vaccines available to us, and I encourage all adults that are eligible to go ahead and get your vaccines because that'll protect you from this Delta variant. It'll keep you from getting hospitalized, and it'll keep you from getting severe infection and severe disease. And it'll also decrease the transmission from you to others that are unvaccinated or vaccinated. So these are the benefits of the vaccine. Please talk to your personal physician, your primary care doctor, or your pediatrician if you have children. The vaccines currently are administered to people 12 and over. So if you do have middle school children, the recommendation from the CDC and from all medical establishments is to get them the vaccine, especially if they're going back to school or they're starting school in a couple weeks or next week. Some people have started now. We'll discuss some of these issues today pertaining to going back to school in this pandemic and trying to have the optimal situation for us in different types of situations that might come up. So we're just going to discuss those things. Again, in children, children are fairly resilient. It's nothing to panic about. It's something to plan. It's planning. Proper prior preparation is very, very important. And if you do have children and they are going back to school, you need to plan for different outcomes that might happen. And there's no reason to panic. Everything, there's guidance, there's a way to navigate through these things so that you have the optimal outcome for your family and for your children and for your loved ones. So, that being put aside, we have currently, I was reading this morning, there's 40 states that the number of infections have doubled in the US in the general population. And unfortunately, the majority of these people that have contracted the COVID-19 Delta variant are what's known as the unvaccinated population. And a lot of them are in hospitals. A lot of the ICU beds in these states are getting filled, and they're again putting up tents and they're putting up makeshift facilities so that they can accommodate all these ICU beds. And unfortunately, this is very tragic to hear because now the tragedy of COVID-19 is that it is preventable. The vaccines will prevent the severe disease. It will prevent the hospitalizations. It'll prevent our medical system from getting overwhelmed. But unfortunately, for one reason or another, people are not getting the vaccine. Here in California, now the number is 70% plus have at least one vaccine that they've taken. If not both shots, they've taken one shot. So that's a great, great blessing because the less the virus survives in the community, the less it'll mutate, the quicker we can get rid of it. So this is very simple. The less it's out there in the community, The more people are vaccinated, the decrease in the viral load out in the community, and the quicker it will be gone, and we can have semi-normal lives again. But this is something that has now become, I think, politicized, and unfortunately, there are people still that don't trust the science or don't trust the doctors that are telling them to, for God's sakes, go ahead and get the vaccine if you're eligible. You don't have any other immunodeficiencies. You can get the vaccine. Please go and get it so you protect yourself, you protect your loved ones around yourself. And most importantly now, children under 12 are not getting the vaccine currently. There's no approval for the vaccine for them yet. So because of those children that are around you, you should definitely get the vaccine so that you don't have the risk of spreading it to them, and you'll protect them. The recommendation now is from the CDC that any adults that are near children 12 and under should be vaccinated. It's very clear, and you see the mandates that are there from the private industry. You see people talking about services in, for example, New York State restaurants. Anywhere you go out, they will require you to have a vaccine. And this is, it makes sense. It's just a public safety issue. This is not a personal political issue anymore, and it hasn't been. But unfortunately, there are people that twist it in that fashion for their own gains. We have to be smarter than that, especially now, because now it's back to school. We want our children to benefit from the experiential nature of school, where they're getting taught by their teachers, they're among their peers. It's much better for them psychologically, and we have to measure the risk and reward of that now, because children under 12 do not have that vaccine, and we're sending them to a facility where they're going to sit 6 to 8 hours, 5 to 8 hours, 5 to 7 hours in an enclosed environment, breathing the air of other children that aren't vaccinated. And we don't know if their parents or the adults around them are vaccinated. So the best way to protect these children is to have all the adults around them vaccinated. If you don't do it for yourself, please do it for the children, because the recommendations have been there for the children. Now they're even trying to politicize masks. Obviously, if you don't have the vaccine and you're in a situation where you're indoors, enclosed, and sharing the air with others, you should definitely wear a mask. A mask will decrease the viral transmission, the viral load going from one person to another. Again, COVID-19 gets spread through respiratory droplets, meaning if you cough on someone, if you sneeze on someone, that's how it gets spread. And this Delta variant is multiple times more transmissible. So meaning that people will catch it quicker and faster and in bigger amounts. If before you were capable of infecting 2 people with the regular COVID-19, now they're saying that same person will infect 8 to 10 people, because that's how infectious and transmissible the Delta variant is. So it's very important that if you're in public, if you're in places where you don't know the status of people, you should definitely mask up. And fortunately now they're mandating masks in most places where there's no politicization of this issue. People are masking up. It's a safety issue. It's a public safety issue. You protect yourself, you protect your people around you, and you protect your family by not taking germs into your house that are unnecessary to take. It's very simple and practical. It's not something where, it's rocket science. It's very straightforward. So we should definitely take account of that and make sure. For those of you who have children, myself, I have a elementary school aged boy that's going to school. You have to make sure that the school has policies in place that'll protect them, whether it be the 3 feet distancing that's recommended, and then masking up. Everyone should mask up. For children, it's very important for their mask to be comfortable. So you can get them a type of mask where they can keep on the longest. That's the most important thing, where they can keep that barrier on their mouth and on nose the longest, the mouth being more important because it's a larger area and more respiratory droplets will get through. So that's very important to get them a comfortable mask they can keep on. And if you're sending your children to school, then you have to. It's our obligation to make sure that we protect them. And I'm sure the administrators at the school and the school district that you're in will have rules and regulations, but this is not a time to be shy and not ask questions and not really ask about the safety protocols that are in place for your children. The issue with children is that they are resilient. Let's say your child comes back and they say, "Hey, there was an exposure." What do? Number one thing to do is you have to kind of isolate them. If they were in a situation where they weren't protected, or they were unmasked, or they had someone that had COVID-19 around them, and the exposure was there, then you have to protect them and get them tested. The PCR test is the standard test that people are doing now. And there's also the antigen test where you can get the result quick. It's a little bit less reliable, but it's still very good, especially if they're asymptomatic or you don't know. It's better to test them quickly and get that peace of mind so that your family and quarantining happens in a organized way. It's very important to do that. A lot of facilities or schools now are mandating the mask, which is great, and they should be mandating per CDC the 3 feet guidelines where people are still apart. Now that the numbers are going up, we'll see what happens. It's a fluid situation. Recommendations are changing and coming in daily, which is good. That means people are working on it and are actively looking at it from the governmental level. It's important for them to be on it and taking all the data. There was a facility in Georgia, a school that opened, and they had a huge outbreak. I think 150 to 200 people, and that was last week, and they all went back home in quarantine. So these things can happen. You should be ready for them. Fortunately, a lot of the districts that can't afford the weekly testing for some of their teachers that aren't vaccinated, there has to be a solution for that as well. California state here has mandated at least all their health workers, all the county workers, all state workers to get the vaccine. Different states have different rules and regulations. Unfortunately, you have to check with your county and with your state and what's going on, and more importantly, just check with your school and see what they have in place. With the Delta variant, a lot of people are presenting with headaches and runny nose. That's what's been noticed by our colleagues in the hospitals. They report that they get headaches and runny noses, and that's something a little bit different than the standard presentation of coronavirus or COVID-19. So keep that in mind. But again, it's no reason to panic. It's just a matter of having contingency plans. If you have multiple children, obviously you have to figure out how you would quarantine your child, the one child that would come back, or if they're in the same school, both children. So, and then usually, if they have been exposed and they weren't protected, usually within 10 days they're not infective anymore. So you would quarantine them for 10 days and then get back to normal. You yourself would take care of them, but you would be masked up in the house with them. Ideally, you can put them in a room or a situation where they're breathing their own air, but that's impractical if you're living in one household and you have multiple children. So if you have a room for them with a bathroom, that's where you would try to isolate them. And the most effective time would be the first 4 to 5 days. So that's when you want to avoid hugging and cuddling them, even though they're young. Have them, put some movies for them, have them relax, and just kind of nourish them and give them nurturing so that they get through. That's important to know. And of course, in terms of if you have multiple children and you're trying to isolate each other, then it becomes a little bit more of a logistical challenge. So it's always good to have someone, an adult family member or an adult friend that lives close by that is vaccinated. So you might need to, isolate someone with them, or have them help you out. So that's something to keep in the back of your mind, in case something comes up once your kids are in school. Unfortunately, the stats with the Delta virus, 22%, so at least 1 out of 5 infections currently from the Delta variant are in children. That's very important to keep in mind. So infections are happening because they are unvaccinated. I think there was about close to 94,000 cases that were reported in children in the past week. So, that's quite significant rise. A lot of the ER docs and the hospitalists that you talk to, they'll tell you that, there has been an increase in pediatric admissions due to COVID, especially in states that are unvaccinated. They have high unvaccinated rates. If you look at these states like Texas, Florida, Alabama, Louisiana, a lot of these states that are in the southern belt that were resistant to masking as well as vaccinations have now the highest rates of COVID infections. And this, the data tells you, the data is not lying to you. So you see that. So it's very, very important that we all go and get that vaccine. My children that are 12 and over, all of them have had the vaccine. They've all done well. I have 4 children in that status. They've all done that, taken the vaccine. They took the Pfizer vaccine. All of them are doing well. They didn't even have that many side effects in terms of, they just had pain in their arm, and they felt a little tired for one day, and after that they were fine. So it's the benefits and the risks. The benefits definitely outweigh the risks, especially in this environment, because we would hate for our children to catch this and then go into severe disease. And the way to protect them is to have ourselves vaccinated, and then for them to definitely wear masks when they're out and about and they're exposed to people that we don't know if they're vaccinated or not. And it's in the community now. And what we need to do is decrease this virus in the community. And the way to do it is increasing the vaccination. It's very important. Increasing vaccination or just isolating ourselves. So you have 2 options: isolate yourself, stay at home, don't go anywhere, and don't get back in the swing of things with society, or vaccinate and have a life that's a little closer to what it was before COVID. And but still be careful. Breakthrough infections are what's people that are vaccinated that have gotten this infection. So the difference is very stark. You notice if you're unvaccinated, the rate is about 10%. 10% of these people are getting the Delta variant. So 1 out of 10 if you're unvaccinated. If you're vaccinated, it's 1 out of 1,300. So that's like a 0.04%. It's not even 1%. So look at the difference in terms of getting the infection. So if you're vaccinated, that's the protection it offers you. And it's basically a no-brainer to go ahead and get that. A lot of people still subscribe to these conspiracy theories that, the vaccines cause infertility, et cetera, et cetera. We right now don't know the long-term effects of COVID either. So there are viruses, for example, that later on in life cause cancer. They remain dormant in your body, and later on they mutate and they cause some type of illness in the body. So it's better to protect ourselves against all viruses rather than having this lackadaisical attitude and saying, you know what, we're just going to see what happens, and I'm just going to kind of rough it and not take the vaccine, be very lax on the masking. Unfortunately, these people that aren't taking the vaccine are the same people that are very lackadaisical and relaxed with taking precautions as well. They don't mask up properly. The mask for the children, you want to make sure that it covers their mouth and nose securely. And then there's also the recommendation for some, if you have the little cotton soft masks, double up on those, and that'll give you that extra layer of protection. So it's important to keep these things in mind. A lot of the news that you see nowadays, you'll see that the numbers are going up again. It's the fall. Naturally, viruses do replicate better in the fall. And especially now that the schools are back in session, people are going to school. So you need to keep your eye on your children. Practice all the social distancing that you can, washing your hands. You know the basics by now. We've been in this pandemic for more than a year and a half now. So you know all the basics. Practice those. But now that the schools are opening up, you need to be a little bit more vigilant and a little bit more advocate for your children. I would definitely bring it up with the PTA, with the school board, with the school, especially if it's a private school. If it's a private school, they can mandate that the parents all be vaccinated. If you're bringing your children into the primary school, they can mandate it. There's no problem with that. It's a private school. If everyone agrees, they can mandate it. It's an issue of public safety. We want our children to have the optimal conditions while they're at school or this environment where there's an increased chance of infection. So with that, I'd like you to let you know that if you have any questions, any concerns, please comment, please send us a text, and keep yourself and your family safe. Again, if you're not vaccinated, please vaccinate. If it's not because of yourself, you have political issues, do it for the children around you and for the society, and also for the elders. They're due for boosters coming up in the fall and winter. They're going to be boosters coming up for elders as well, especially if they're 60 and above and they have other co-founding conditions. If they have any immune compromised diseases, any type of diabetes or heart disease or anything else, they will start boosting those people up as well, so that their antibodies are in a place where they can fight the virus and not get it. So with that, I'd like to bid you farewell, and we'll see you next week. Hopefully you can share this information with others, and have a great school year for you and your children, but be mindful and vigilant of things. And the key is not to panic and just to plan. Planning is very important, and to keep calm, and God willing, everything will go well. See you guys next week. Take care.